So how many people here have a CVS card? Wow, okay. Pretty good. So our special guest is Larry Merlo. As I mentioned, he is the CEO of CBS Health and has been the president and CEO since 2011. He previously was the president of CBS in 2007. He is a native of Pittsburgh, grew up in the Pittsburgh area, and went to University of Pittsburgh to get his pharmacy degree. And then after he graduated in 1978, he joined People's Drugs, which was later acquired by CVS, and so he's joined CVS. He is very involved in a number of philanthropic organizations in Pittsburgh, and he's on the board of the University of Pittsburgh. CVS is a company that has done quite well under his leadership. Since he became the CEO, the stock is up 110%, which is pretty good. Wish I had bought it. The company itself is quite large, as you probably know. It has a market capitalization of roughly $76 billion. It is a company that has about 246,000 employees, 9,800 drugstores in the United States, Puerto Rico, and Brazil, and has about $148 billion or so in annual revenue. And we'll hear a little bit how the size of the company will grow shortly after an acquisition that is likely to be finally approved by state regulators is done, the Aetna acquisition. So it's my pleasure to introduce the CEO and president of CBS Health, Larry Merlo.
Thank you. Well, David, thank you for the introduction. And by the way, David does not have an extra hair card, okay? I was telling him at lunch how much he's missing with extra bucks, and all of you can remind him of that when you see him later. Let me also acknowledge the members of the Economic Club here in Washington. You really play a vital role in providing this forum for sharing, learning, debating, and discussing the pressing issues of our time, and your commitment to the local community here is very evident, so let me thank you for that. I'm here today to talk about one of the most pressing issues facing our nation and our economy, and that's healthcare. Today it accounts for more than 17% of the US GDP. That is equal to more than $3 trillion, or about $10,000 per person. About 10% of that spending is due to prescription drugs, and I'll come back to that in a few moments. The other 90% of US healthcare spending can only be addressed by what we consider to be fundamentally transforming the healthcare system itself, which, as we all know, is not delivering the value that it should. We look at today's healthcare system as one that is episodic, it's fee-for-service, it's a fragmented model, it's confusing, it's difficult to navigate for many. It doesn't meet people where they are, give them the information they need, or help them connect what we refer to as the dots of care. So in the end, it doesn't put consumers at the center of their own care, which is where they really need to be, because consumer-driven healthcare is increasingly becoming the norm. Today, more than 30% of covered workers are enrolled in a high-deductible health plan, or as some call them, consumer-directed health plans, and that compares to just 4% a decade ago. We have pushed people to become more accountable for their healthcare decision-making, but the tools, the capabilities, and the products and services that they need haven't kept up. And many consumers don't really know how to use what's available to them. Importantly, healthcare is not a commodity, and it can't function effectively with a one-size-fits-all approach. So in creating a more affordable, effective, and better healthcare system, I would argue that we need disruptive innovation from within the healthcare system itself. And the combination of CVS Health and Aetna is designed to do just that. We were very pleased to announce just last week that we received clearance from the Department of Justice to proceed with the transaction, and we expect to close the transaction in the fourth quarter of this year. So let me take just a few minutes to explain how bringing together CVS Health and Aetna as one company will help bring about the disruptive, transformational changes that are more broadly needed in our healthcare system today. So let me ask you to think about your own experiences in healthcare. I'm going to ask you, are you a patient? Are you a consumer of healthcare, or are you both? Well, if you're sitting in the exam room in the doctor's office, or heaven forbid, on the operating table in the hospital, you most certainly are a patient. You're relying on the physician's expertise to diagnose, treat, prescribe a course of treatment. And let me go ahead and introduce you to Diane. Diane is a person with a new diagnosis of diabetes. She leaves the doctor's office with a care plan. It will have instructions for new medication that she'll need to take. It'll have lab instructions for blood work to measure her sugar levels. It'll have instructions for her diet, instructions to lose weight. But will Diane know how to execute her care plan effectively? Her doctor warns her that if she doesn't get her blood sugar under control, her risk increases significantly for diabetes-related complications like heart and kidney damage. So it's at this point that Diane just isn't a patient. She's now also becoming a consumer of healthcare, because you think about it, as a patient, she has gotten expert advice from her physician. But as a consumer, she is now accountable for finding and accessing the services that are called for in her care plan in the most effective and affordable ways. And as a consumer, she is now engaged in the steps that she needs to take to follow and execute that care plan to stay well. Now, fortunately, whereas she might see her physician 4 to 5 times a year, she is likely to see her pharmacist as many as 18 to 24 times in the same year. And this is just one example where the combination of CVS Health and Aetna can make an important difference. So we think about this new company leading the change that's needed in American healthcare in 3 important ways. First, we will be local. Today we have a presence in 10,000 communities all across the country. And our combined company will be able to offer many options to access care, whether it's in the community at a retail pharmacy or clinic, or perhaps in the home, or through digital tools and capabilities. Second, we will make it simple. Through our combination of data, information, and expertise, we can make this often complicated and confusing system easier for all. And third, we will work hard to improve health. We will be uniquely positioned to help to personalize healthcare and help people achieve better health at a lower cost and access care when and where they need it. And I'll look forward to expanding on this vision, I'm sure, with David more in the conversation. Before I do, I want to come back to prescription drug spending. I mentioned earlier it accounts for about 10 cents of every healthcare dollar. We know many Americans struggle to afford their medications today, and some have pointed fingers at pharmacy benefit managers or PBMs, along with others in the drug supply chain, as the cause for this. And one pharma CEO recently remarked that the supply chain was retaining up to 55% of the profits on prescription drugs. Now, as the leader of a company that is part of the supply chain, I am here to tell you that this is simply not true. What was left out of those comments is that almost all of that 55% flows back to employers, flows back to other prescription drug plan sponsors in the form of discounts. In fact, we project that this year, 2018, our PBM clients will receive about 98% of the discounts and rebates that we obtain from pharmaceutical manufacturers. And the truth here is that drug manufacturers set drug prices, and prices are higher for drugs that face the least amount of competition from generic products and other therapeutically equivalent alternatives. And the important role that's played by PBMs is to negotiate discounts from drug manufacturers on behalf of their clients, and to also deploy a variety of tools to ensure that their members receive high-quality pharmacy care at the lowest possible cost. And as an example of that, last year, 2017, drug price growth for our own clients was only 0.2% on a per capita basis, despite list price inflation of nearly 10%. And if you look across the entire PBM industry, these time-tested market-based techniques are projected to save the healthcare system more than $600 billion over the next decade. Through the combination of CVS Health and Aetna, we believe we'll also be able to do even more to help lower overall spending associated with prescription drugs by helping people stay adherent to the medications that their physician prescribes, which, as you would expect, can prevent more costly interventions like hospital admissions or visits to the emergency room. So let me summarize just a few of the things that I touched on. We'll be there when patients pick up their medications to talk with them face-to-face and answer questions. We'll expand the use of digital tools that empower patients to better manage their health and wellness. And these tools can help patients monitor key indicators. Think again back to Diane. Diane's managing her blood glucose levels. We can help her with that and actually send text to her or her caregiver when the results look concerning. We'll even be able to help some people avoid developing chronic disease in the first place. We'll have the data to predict who's at risk and the ability to provide them with preventative counseling in a convenient and local setting. And we'll be able to do all of this not in an ad hoc or fragmented way, but seamlessly with patients, their physicians, and many other players it takes to coordinate care. So the new healthcare model that we intend to create through this combination of CVS and Aetna, it's bold, it's disruptive, it's truly unique, and it's also achievable with the right engagement at the community level. We'll be local, we'll make it simple, and we will work to improve the health of those we serve. And we can't wait to roll up our sleeves and get started. So with that, David, come on back up and we'll start the conversation.
So you mentioned that I don't have a CBS card, which is true.
I was also working with him to get him to download the CVS app. How many have the CVS Pharmacy app?
Okay.
See what you're missing out on, David?
So my theory is, tell me why I'm wrong. My theory is, whenever they have these places, they say you want the Barnes & Noble card or this card, I'm going to get on the email list, and I'm going to be getting emails for the rest of my life because they're going to use my email address, and then they're going to sell it to other people and so forth. I'm going to get thousands of emails I don't really want. Is that wrong?
That is wrong, because if you have the app, you can take all those offers and you can decide what's relevant for you, send it to your card, and you don't have to bother with the emails anymore.
All right, if I had a CVS card, how much would I really save? And you cut through everything. Am I saving 5%, 10%? What's the average?
You know what, we were sitting here talking at the table. We have shoppers out there that, are very, I would say that they're students of the shopping experience, and I wouldn't be surprised if those discounts were as much as 30%.
30%, wow. When I go to these CVS places and they say, do you have a CVS card? I say, no. They don't actually say, well, you should get one. Do you train your people to get, or they just leave people like me alone?
Tell me what store you shop at. I got to go back and follow up with that.
Okay, I won't do that. So let's go back to the acquisition that you've done. You've grown the company quite nicely. It has, let's say, a market cap that varies between 75 billion and 80 billion, something like that. You're buying Aetna Health, you paid 69 billion for. You're paying 69 billion. So I know from my own experience, when you're a company of the size that you're buying, roughly, you're a little bit bigger. If you put these two together and it doesn't work, that's not good for your company, right? Because you're buying, it's not like a little thing. If it doesn't work, you can push it aside. You're buying something that's almost the same size. Have you thought about that?
Maybe I'll take you to our next investor meeting.
All right, okay. All right, so this is not a bet your company kind of thing, but it's a big acquisition.
David, listen, you're right, and it is an important question. And think about some of the things that we've talked about. We've got healthcare continuing to grow at an unsustainable rate. Left unchanged, we're headed to 20% of GDP, and think about the challenges that's creating, in terms of funding infrastructure, funding education. You hear that whether it's in state governments, here in DC, you certainly hear it, within employers, challenging in terms of with CVS ourselves. We spend 1.2 billion in terms of healthcare coverage for our employees and dependents. So, our belief, for the reasons that I mentioned, is that there is consumerism entering healthcare. Healthcare is local. We have an opportunity to make it simple. And go back to the example that I used with Diane. We are not going to cure Diane of diabetes. However, we can help her, achieve her lifestyle goals, okay, and in doing so, avoid the complications that are all too common, with diabetes. There are 30 million people walking around today with full-blown diabetes. Here's the scary fact. There are another 84 million people who are in some pre-diabetic state. If half of those, just half, develop full-blown diabetes, we're looking at another $400 billion in healthcare costs that doesn't exist today. So David, we're sitting here saying that, yes, this will take some time, to build the tools, the capabilities, the products, the services in the market, but we can help people achieve their best health and at the same time reduce costs.
So you're buying it for $69 billion. You're not it's been approved by the U.S. Antitrust Division, is that right?
Correct.
So was that a matter where they just loved it and they said yes, or you had to go in and talk to them, you hire lawyers, you talk to other people? How long did it take you to get this?
I'm looking over at our general counsel because he's
How long did it take to get this approved?
No, you know what? First of all, I want to give Tom and his team a tremendous amount of credit because we've seen many challenges in the marketplace. We got the DOJ approval in 10 months. I would say that it was a very detailed and thorough process, and I'm very proud of the work that Tom and his team have done, and we're very pleased with the outcome.
But as always the case, when you think you've got something, you always have something else you have to do. So you haven't got all the state regulatory approvals yet, right?
That's correct.
So how many, you need like 28 or some of those?
Yeah, 28, 29, and we're in the home stretch around that.
Okay, so you expect this deal will close by the end of this year?
Yes.
Okay. Now, when it closes, if I'm still a CVS customer, and I will be because it's right near my house, I have no choice, so it's right near my house. But I'm happy with it. I'm really happy with it. They treat me very well. And I'll tell you later some of the good things they've done. But how am I going to benefit? I'm going to CVS every day. I'm getting my newspapers and other stuff. How am I going to benefit by your owning Aetna?
You know what? Here's the interesting thing. When you look at Aetna or a health insurer, they have a tremendous amount of information about the members that they serve. And Aetna likes to describe it as we have all this information and we have the next best action for the members that we serve. But think about this for a minute. How does that get executed? We were talking earlier about what's the consumer behavior change that is going to improve the health of individuals. So listen, a health insurer, what do? They call your home. I don't know about you, but I don't answer the phone at home anymore. Okay, all right, and I sense I'm not the only one from some of the laughter. Now, if the health insurer has your cell phone number, then they try. If they have it, they try you there. And if someone needs to get a hold of me, their number's in my directory. So if I don't recognize the number, the name doesn't come up, I don't answer that either. So then what happens if you're 0 for 2? Then they put a letter and send it to you in the mail.
Right.
Okay, and what do we do with that? So the point that I'm making is, a health insurer has a tremendous amount of information, and they can help intervene if somebody's at risk. Go back to those pre-diabetics, or there are just countless stories.
Let's suppose I'm an Aetna Health. I'm insured by Aetna. How am I going to benefit by Aetna now owning or being owned by CVS?
Because you back to the story that I'm sharing there, that we can now use the CVS assets with which to, here's what I know about the member, and by the way, we can deliver that intervention through one of the ways that we engage or talk to our customers, whether it's in the pharmacy, and the role of the pharmacist, the role of the nurse practitioner, I believe is going to expand in this new model.
Now, who came up with the idea of doing this? Did you come up with the idea? Did you call up the CEO of Aetna and say, guess what, we're going to buy you? Did he say, that's a good idea? How did the idea come about?
You know what, David, we, CVS and Aetna have had a business relationship for more than 8 years now. So, Mark Bertolini, the CEO, and I meet on a regular basis. We're having dinner one night in Hartford. If you know Hartford, Peppercorn's Restaurant, famous place, okay? And we were talking about deepening our our partnership and some of the things that we could do. And through that discussion, again, continuing the story in terms of things that we can do because we're out in the communities. We would incur the build out, the cost associated with managing that. And when you think about the value that's created, it really accrues to the health plan if we can reduce healthcare costs. So the economic model really doesn't work, okay, with
so
that
he
construct.
agreed. He said,
well,
that's a good idea.
one thing led to another, and that brings us to where we are today.
So what's the name of the company going to be in the future? CVS Health Aetna or just CVS Health?
It'll be CVS Health, and Aetna, will be an important component of CVS Health running as as a separate business.
So when you were, during your term as CEO, I think a couple years ago, 2014, you said no more tobacco. You were selling tobacco, all kinds of tobacco products. Whose idea was that, to get rid of tobacco?
You know what, David, as we were beginning on our journey of becoming more of a healthcare company, our chief medical officer was, out in the community meeting with some of you in this group, and, and he said, Larry, and members of the management team, you got to come with me to some of these meetings because we're having great discussion. And about 2/3 of the way through the meeting, somebody would turn around and say, yeah, but you sell tobacco products, don't you? And it literally, sucked all the energy out of the room and created, an integrity question in terms of the motives of the company. Okay. And, and by the way, several of us went out with them and we saw it firsthand. And, as a management team, we had a lot of discussion, healthy discussion, because at the time, we were selling $1.5 billion worth of tobacco products, and there was another $500 million worth of somebody coming in buying a pack of cigarettes. They were also buying chewing gum, water, mints. Well, essentially, they were using us as a convenience store. So there was $2 billion of revenue at stake. And we had a lot of healthy discussion and decided that, listen, we're not going to make that up, in 1 year, maybe not even 2 years, but it was going to be a barrier to the future growth of the company and the strategy that we were pursuing. And we actually went to our board, had discussion, and made a decision.
When you announced it, did your stock go up or down?
The day we announced it, the stock went down 7%.
And did you say, well, maybe we didn't mean that, or you didn't know?
No, David, I wished it was that simple at the time. Listen, we had talked about the strategy of the company. We went back as part of that announcement and, and once again articulated the strategic direction of the company. I will say, as we look back on this, and we have two of our board members sitting here that were part of that discussion, and we got great support from our board, and I can sit here and say it did open new doors, and it did enable the strategic direction of the company to come to life. And as I look back 4 years ago, it was absolutely the right decision. Looking back, and by the way, importantly in this. In the first year, we saw a 38% reduction, in tobacco sales, in markets where we had a sizable presence in the country.
Now, the second largest drugstore chain in the United States, is that Walgreens?
Yep.
Right. And then third, effectively, is Walmart.
Correct.
Right. Have they announced the same policy on tobacco?
They have not. And and listen, I have tremendous respect, David, for all of our competitors. They do. They do terrific things, but listen, I think this is a point of differentiation, in terms of, how CVS is focused in the marketplace, on things that may be different than some of these competitors.
What about opioids? Now, opioid addiction is a big problem. How can you really deal with it? Because what you do, I guess, is if a doctor prescribes an opioid-related product for his patient or her patient, you have to prescribe it, or you have to give it out to them. So what are you able to do to deal with the opioid problem?
Yeah, David, it's a great discussion. And listen, this is a problem that we should all be concerned with, that, it doesn't discriminate anymore. I think everybody thought it was in, the urban, cities, but it's in the suburbs, it's in rural America, and, it's a great cause for concern for us. And David, some of the things that we started doing a few years back, and think about what's in your medicine cabinet today. And we started doing drug take-back programs. We started working with local municipalities, the police departments, putting in receptacles. The next thing you knew, we had taken back a couple 100,000 pounds of unused medications. Now, to be clear, this was not all opioids. And
when you take it back, what does that mean?
That means customer brings it from their home to one of these receptacles, and we ensure that it's safely disposed of, from both the security as well as the environment.
But in other words, why is that easier than just throwing it in the trash can in your house?
Because it's not it's not secure, and it's not environmentally safe as well. So one of the discussions that ensued, we could go and empty every medicine cabinet in America. By the time we're done, we haven't gotten to the root cause. And, and I'm sure every one of us here can relate a story, whether you went to the dentist for a root canal or an extraction, or you had some acute injury, and the next thing you know, you're walking away with a prescription for 60 or 90 Oxy or OxyContin or Hydro. So one of the things that we began to do was, working with the medical community in terms of, listen, doctor, whatever quantity you're writing for, if it is a first-time user of an opioid for an acute injury, we are going to limit the quantity that is being dispensed to that patient to not more than a 7-day supply.
Well, suppose you do that, and the doctor says, well, I'll go to Walgreens then.
You know what?
First
of all, David, I could tell you that, that has not...
That doesn't happen?
It has not happened. I think physicians, recognize their professional responsibility in this dynamic. But this year alone, we have seen more than a 70% reduction in the number of opioid prescriptions being dispensed for more than a 7-day quantity.
Now, when opioids, you have them in the pharmacies, how do you know, somebody not coming along who works there and maybe putting 1 or 2 in their pocket?
That would be a problem, okay?
Right? How do you prevent that?
Well, listen, first of all, our pharmacists, just as everyone across the medical profession, they understand, the standards of, professional practice, professional responsibility, and there are very, very stringent inventory and security controls around those products that, if something is missing, we will know about it in short order.
Okay, so another policy you have, I noticed when doing some research, which was this. If a company puts advertisement or things on their packaging that enhances women, that makes them look younger, thinner, less wrinkle-free, whatever you want to call it, you don't sell that. But what about men? How come if they put pictures of men and they make them look stronger, do you do those? Do you sell those products?
David, I'm going to take that back as a recommendation.
Okay, all right, because I think, we want equal treatment too. We want to know what we're supposed to look like, and, you look at these packages, these guys with muscles, it makes you feel bad. But okay, so what's the reason behind your policy?
Well, David, some of what you're describing is really, I'll describe it as an outpost from the tobacco decision. That, I would say that, we spend a lot of time talking about purpose in our company. And our company purpose is what we do to help people on their path to better health. And I think, David, one of the things that, and by the way, you mentioned we have, over 250,000, employees, and I consider myself fortunate in terms of the quality of our workforce and the dedication that, these folks have to our company and our purpose. And one of the things that, happened after the tobacco decision is, people across the organization, based on the role that they had, started talking about, well, this is what, we could do, or here's another thought, that is tied to that purpose. This happened to be one example where, it had nothing to do with pharmacy, okay? But, there's a lot of literature out there today in terms of, the younger, the teens, okay, in terms of seeing these magazine articles and seeing these things on TV, how they're developing unhealthy behaviors, to be able to emulate and look like these people. Another example is, the person that manages the sun care products for us, came back and said, there's no clinical literature that speaks to the effectiveness of a suntan product with an SPF less than 15. But yet we sell an SPF of 8. Why are we doing that? And as a result of her initiative, we stopped selling any suntan products that don't have at least an SPF of 15. Yes. And by the way, there are many, many other examples like that.
All right, so let me ask you this. It used to be, Ronald Reagan once famously said, the most dangerous words in the English language are, I'm from the federal government, I'm here to help you. And so for business people, sometimes the most dangerous words are, Amazon is getting into your business. So recently, Amazon spent $1 billion buying a company called PillPack. 1 billion, 1.1 billion, something like that. Their market cap went up, upon the announcement, of 20 billion. The 3 largest drugstore companies in the United States, their market cap went down by like 6 billion. So how can you explain that? Are you worried about PillPack and people who don't get, use that company. What is PillPack, and do you do the same kind of thing?
Yeah, I'm trying to figure out, David, where I want to start this
All right,
discussion.
well.
Okay. No, let me, and it is an important question. First of all, listen, Amazon's a great organization. I thought where you were going to go is, do you lay awake at night worried about Amazon?
Do you?
And listen, what we worry about is, how do we meet the needs of our customers, okay? And, so, we spend a lot of time listening to our customers, and, our belief is a customer can never tell you what to do next, but if you listen well, you'll hear the things that they're not happy with or things that they would expect you to do better, and then it becomes our job through, innovation, new product services to, meet the unmet need, okay, that is being felt in the marketplace today. So that's what we focus on as an organization, with the goal being, don't leave any white space for Amazon to disrupt. Okay. So, in the case of PillPack, PillPack is, you go to I'll say a traditional pharmacy, and you get your prescription for high blood pressure, and there's a nice amber vial, okay, and PillPack dispenses. Let's say you're on 4 medications now, and it puts everything in a nice cellophane package, so you don't have to sort your medications by day by dose. Okay, so it's really intended for a very high pharmacy user that may be suffering from multiple comorbidities. And yes, we have those capabilities today. It's a very niche-y product because these are our most vulnerable populations. So oftentimes, they're the ones that are having their medications changed or their dosage changed. And the minute you do that, whatever is left from that cellophane roll is now waste. So you typically don't see, those medications being dispensed in 90-day quantities or even 30-day quantities for that matter.
So, I see. But right now, Amazon sells many of the products by overnight kind of mailing that you sell, right? They haven't done prescription drugs. Now they're going to, in fact, be in that business as well?
Listen, the acquisition of PillPack does give them a pharmacy license with which to,
Did you think of buying PillPack before they thought of buying it, or?
Well, listen, we have that capability today, and listen, with PillPack, there's nothing proprietary about that technology. It's off-the-shelf technology.
So let's talk about your background. So you were born in Pittsburgh. You grew up in the Pittsburgh area, and why did you decide you wanted to be a pharmacist?
You know what? I actually loved chemistry in high school. I had a chemistry and I liked health, and I had a chemistry teacher that influenced that direction. And
all right, so you went to pharmacy school, and how many years did it take to go to pharmacy school to get a degree?
At the time, it was 5. Now it's 6. You graduate today with a doctor of pharmacy.
All right, so I hope my pharmacist is not listening, but I don't know. Explain to me what a pharmacist does that is so complicated, because now what you do is you get the prescription and he or she fills it. Where's the discretion that requires you to have 6 years of college to know that? I mean, I assume it's complicated, more complicated than I'm making it, but in the old days they used to make some of the drugs maybe in your pharmacy in the old days, but now everything's made in advance, so you just say, put in 3 pills here, 2 pills there. How do you determine a good pharmacist from a bad pharmacist?
David, here's the secret sauce. Okay,
all right.
First of all, think about the healthcare profession. Okay, the pharmacist is the most accessible healthcare professional that exists. And by the way, I'm not isolating this discussion out of CVS. Okay, you can walk into any pharmacy and, can I speak to the pharmacist? And, as a practicing pharmacist, I was talking to the judge earlier, and he told me he went to CVS this morning, and I asked him which one. He said the one in Georgetown. I said Wisconsin and O Street. He looked at me, said, yeah. And then I told him I managed that store in 1981. Okay. All right.
And you said the prices are the same as 1981.
No, they are not. Okay. All right.
Okay.
But listen, as a pharmacist, you're the most accessible healthcare professional. Nielsen and Gallup have done surveys for the last 15 or 20 years. Pharmacists consistently have ranked, in the top 2 or 3 most trusted professions, not just within healthcare, just broadly. As a pharmacist myself, going back to those days in Georgetown, I was always amazed at what a customer would tell me about their health or the questions that they would ask me. And oftentimes I would say, have you talked to your doctor about this? And they would say, no. Should I? And I would say, yes. And then oftentimes, well, would you call him for me? So there's this, I don't want to refer to it, David, as magic, okay? But there's this level of trust, that exists that, a pharmacist is that, they are that resource. And there's so much more that a pharmacist can do to practice to the top of the license that go well beyond,
obviously
I got you going. You got me going now.
It's more complicated, but here's, for example, how does one rise up from being a pharmacist to being an executive? You're a pharmacist. You were initially at People Drugs, is that where it was? And so when you were a pharmacist, where were you doing it? In what area? Here or?
Here.
You were in Washington, D.C.?
Yeah.
At what part of Washington? You were doing People Drugs here?
Yeah, I had the store over on East Street across from the State Department, Georgetown.
Okay.
A couple stores in Northern Virginia.
Okay, and so government people are coming in all the time, getting things they needed? Okay, all right. So,
we call it HIPAA today, okay?
Okay, so how do you go from being a pharmacist to being a manager? Because I assume most of your pharmacists are not rising up to be CEO or managers. So what is it that you think you did that made somebody say, this guy is better than being a pharmacist, he should be an executive?
David, I would, and people, CVS is not alone in this. People's, had started this. CVS has this today. I know some of our competitors do the same thing. We have management development programs for, pharmacists who aspire, to, move into the business end
So now you
of
do
pharmacy.
that.
And that's how all that got started.
All right, so CVS, I should have gotten to that. Where did CVS start, and what does CVS stand for?
Well, the first store opened in 1963. As you mentioned, we're headquartered in Woonsocket, Rhode Island, very northern part of the state.
Now, why did you pick there? Because it's not exactly a big city, is it?
You're right. The founders, the Goldstein brothers, were actually born and raised in Woonsocket. That's how it got started. They opened their first store in Lowell, Massachusetts. It did not have a pharmacy. It was about 1,500 square feet. It sold just health and beauty products. So 1,500 square feet be about a tenth of the size of today's CVS pharmacy.
All right, and then CVS stands for?
CVS stands for Consumer Value Stores. This is, Stan Goldstein, one of the founders, Stan's in his late 80s. He's a great storyteller. He loves to tell the story because oftentimes what does CVS stand for? And it's Consumer Value Stores. If you saw a first picture of that very first store, you would see the words Consumer Value Store spelled out. And if Stan were here, Stan would say, we got the CVS because when I got the bill, for that sign, it's a lot cheaper to spell out 3 letters than it is 3 words,
So, all right, today you have 9,800 roughly stores, is that right? But you're not outside the United States that much. You have Brazil, but are you thinking of going other places, or?
You know what? We think about international being in our future. At the same time, there's so much opportunity, in healthcare that, that's somewhere down the road.
Okay, but like Canada is right on. A lot of times, U.S. companies have things in Canada, and you could tell people there CVS stands for Canada Value Stores. You could do that, but you wouldn't do that. All right. So, what is the biggest CVS store in the United States? Where is the biggest one?
There are some from a size point of view. There are larger stores in California and Hawaii.
Okay, and of the people that you have as pharmacists, you have 9,800 stores. How many pharmacists do you have? Like 10, 20,000?
We have 30,000 pharmacists.
30,000. And would they be half male, half female, or what do you?
No, you know what's interesting? If you look at the pharmacy schools today, about 70% of the graduates are females. That trend has been moving in that direction for probably the last 10 years.
Okay, so in the average, what is the most popular thing bought at a CVS store? The most common thing? Well, that you can legally mention. You can, or you can mention. I don't want to mention certain products, but what is there certain things that that there's certain things that people buy. Like when I asked Walmart, the CEO of Walmart, I asked him once, what is the most common thing bought there? And he told me bananas. That's
Well,
what he
it's
said.
not bananas. That I can tell you.
Okay, all right.
It's going to be one of the health products, one of the
Okay,
OTC
all right.
products, probably a CVS brand.
What is your, or by the way, CVS brand? Like, for example, I mentioned this earlier when we were talking. If I go and buy a CVS product, it says CVS versus, let's say, the name brand, the advertised brand, is there really any difference other than the price is lower on the CVS brand? Is the quality exactly the same?
And we would argue that it is. Okay,
Okay.
we make sure that the manufacturing of those products are at a very high quality, and there are products that we just won't try to replicate because of patent protections. We can't.
But the generic, so-called, the CVS product, let's say you go buy Head and Shoulders and you buy CVS equivalent. The differential in price is at 20%?
It could be 20 to 40%.
Okay.
It'll vary.
Okay, now sometimes, like I said to you earlier, when I go to buy things at CVS, they're locked up. You can't buy them. Like a razor blade, sometimes you lock them up. How do you sell them when you're locked up?
That's a good question. Okay, listen, we have, we're I'm going to stick my foot in my mouth with this one. Okay, listen, you've got the elements of merchandise protection that exist.
So some people steal these things.
That happens. Okay, and one of the things that we're working towards is how can we make it a better customer experience? Because I agree with you that if they're locked up, yes, we've kind of become the sales prevention shelf. Okay, if you can't make it convenient to purchase it. Some of the things that we're working on is making cards for some of those products that have a lot of theft associated. So you can pick up a card, and we'll have the product behind the checkout, and it makes it easy for you.
Okay.
And that seems to be a better solution that customers
I'm in
appreciate.
a modestly high income area in Washington, D.C. Are people stealing razor blades in my neighborhood? I guess they must be.
David, you would be amazed at
people are stealing. Okay.
at some of the things that
All
go
right,
on.
So when I go to the CVS store, sometimes there's a person who does the you check out with, but then you have these machines, and I try to do the machines. I think they're quicker. And reasons I like the machines I mentioned to you earlier is if you have a $100 bill and you want to get cash for it or change for it, if you go to some person and say, "Can I get change?" They say, "No, I really can't make change." But if you go to the machine, they're happy to do it because they never complain. So you give them the $100 and you buy something for $5 and you get $95 back and you get the product. Okay. So when I go to use the machine, very often I notice that it has a thing where it says skip bagging. And then I have to keep changing it back and forth. And I mean, are a lot of people frustrated with these machines, or are they really working well?
We're trying to prevent people like
me.
you.
Okay. All right. But, okay, so when I go in there, these machines, what percentage of people use machines?
No, you know what? We have those machines in urban markets that have an extreme
people use them?
high traffic, and people do use them.
And do people do stealing of it? Because it's very easy to steal where you kind of say, let's suppose you buy 5 things and you scan 4 of them and you just throw one in. Maybe you forget or accidentally, or just say, I'll take one for free.
That's why that skip bag function exists.
That's right. Okay. All right. Okay. So the machines they save you money over employees. I guess that's why you have them. Is that right?
You know what? It has more to do with the throughput of of customers. We can actually get more throughput with a combination of having staffed checkouts and then having these machines.
Okay, now you have also 1,100 clinics.
Yep.
So what do you do? And I've been one of them. When you go to them, what are they? Who are there? Doctors there? Nurse practitioners? Who's there?
No, as you mentioned, we have about 1,100 MinuteClinics. They're staffed by nurse practitioners. Here's the history of this. The MinuteClinic was started probably, I'm going to say 12 or 13 years ago. And and this speaks to some of the earlier points that I made about consumerism in healthcare. Because if you go back a decade ago, who would have thought that I've got 102 temperature and my throat hurts, I might have strep throat. Let me walk into a drugstore, okay, and be seen by a nurse practitioner, have a strep test. If positive, I get a prescription. I go back and have it filled, and I'm back in the car on my way home, all in about an hour. And by the way, at 8 o'clock at night. Because today, 50% of the visits that we see at MinuteClinic are nights and weekends. 50% of the patients that we see do not have a primary care physician. And we've now seen more than 40 million patients at MinuteClinic. I will say that when MinuteClinic first opened, our tagline was, "You're sick, we're quick." Okay, and now that we have evolved that, okay, all right, into something that speaks more to the quality that is associated with those visits.
So it's "You're sick, we get you better," or something like that. All right. So today, do you go into CVS stores very much? I assume you go in all the time.
Do.
So when you walk in, do they have like your picture everywhere, so they know that who you are, or do you tell them who you are? I mean, I assume in Woonsocket they know who you are.
You know what? A lot of the stores, they know who you are.
Okay, so
and
if you walk in, if you came into my store, the one in my neighborhood, I don't know if they would know you, but if you started asking them questions, would they say you're none of your business, or would they would?
No, listen, I'd tell them, if I wasn't, recognized, I'd, let them know I'm from the office, okay, and chat with them, and people are great.
All right. If you're the CEO of CBS Health, as you are, you have to be healthy, right? Because you're not going to be unhealthy. So how do you stay in shape and to be able to say I'm the head of CVS Health? You're not smoking, presumably?
Not smoking. Okay. Need to exercise a little more.
Okay.
Follow my the care plan that my physician has given me. Okay. And
all right. So, for example, you don't sell tobacco; you sell potato chips. Now, potato chips. Would you say they're healthy? Maybe they are healthy. I don't know.
You know what, David? You're raising a good point, because one of the things that we were worried about back to 2014, because you're right, we do sell candy bars and sugary foods, and even in some states we sell alcohol, spirits, wine.
Oh, really?
Okay. And we were worried about where do you draw that line? And it was interesting because we went out and we talked to several in the medical field about what we were thinking about and our concern. And the feedback that we got, very consistent was, listen, there's no amount of tobacco use that can be considered safe. Those other products, moderate, occasional use have not been proven to cause, medical harm. When we made the announcement and went out and talked to consumers, we heard something similar with one addition. Help educate me at the shelf in terms of healthier alternatives. And by the way, that's another one of the things that we've done in terms of introducing snack lines that have reduced trans fat and lower sodium content and things of that nature. Okay. So there are alternatives.
All right. In your current position, you come to Washington very much. You have to lobby members of Congress or the administration. Leave aside your acquisition, but are you here regularly anyway?
I am.
And your mission is to kind of educate them about healthy-related issues, or what?
I would say it's a dual purpose. It's to talk about the company, some of the things that we're doing, okay, and importantly, how we can be part of the solution to some of the challenges that our country faces.
Okay, so where do you think your business is going the next 5 years? And 5 years from now, or 10 years from now, if I went into a CVS store, how will it be different than it is today?
Yeah, well, first of all, you'll see the pharmacy, and maybe it'll be slightly larger. As you look at those products that that are in what we refer to as the front of the store, you'll still see them. There'll be a focus on the health, the beauty, the personal care categories, and what I'll describe as elements of convenience. But you'll see more services that'll be tied to how do we work together to improve one's health.
So if virtually every CVS store, when you walk into them today, the products are all in like the same different place or same place. I mean, you have a science as to where you should put them, and what the science about the stuff in the back is the higher margin stuff or the lower margin stuff?
No, it's if you look at the store today, you think about it. There's really 4 quadrants. You have that health quadrant, that is very close to the pharmacy. You have that beauty quadrant, okay? Then you have that, personal care quadrant, and then you have, the convenience general merchandise. Right. And that's an area that, you'll see de-emphasized as we move forward.
You have, as I mentioned earlier, about 246,000 employees, something like that. So are they minimum wage employees? Are they above minimum wage? Do you have, a big turnover? How long does a typical person stay at CVS store?
Yeah, I mean, you think about the makeup of our store. You know, we've got pharmacists, pharmacy technicians, store managers, store supervisors, and cashiers. So we have a broad cross section of skill levels within the store. I would say that we have a very low turnover of the professional jobs in our store. We have a higher turnover of the entry-level jobs, recognizing that for some of our colleagues, these are first-time jobs for them. They maybe still high school, college age. In many cases, those jobs have had a life impact on them in terms of going into one of our management programs or even going back to pharmacy school as a result.
So as I said, you have 9,800 stores. Would you prefer to have many more? Are you going to build out? Are you always building more every day? How many more are opening? Or are you just kind of happy with where you have them now?
We'll open about 150 stores this year. And we see that trajectory for growth for the next several years.
And the prices for your products in your store versus Walgreens or Walmart, are they roughly the same for these products? Would you say?
Yeah, I would say that there's probably more parity with Walgreens than there is Walmart. I think you would find if you looked at the price on the shelf, you would see Walmart's prices a little cheaper than CVS prices. That's why you need to have an extra care card.
I'm going to think about that. But if I was interested in buying your stock, why would I want to buy it? Is it going to go up by a lot? It's been up 110% since you became the CEO, so that's not bad. Can you do another 110% over the next couple of years?
Well, David, go back to the comments that I made earlier, that we've got a healthcare system that needs help, okay? And we're on the forefront of this transformation. I mentioned in my prepared remarks, healthcare is a $3.5 trillion industry. And there can be more than one successful model out there. And by the way, healthcare is going to continue to grow. Think about the fact that there are 10,000 baby boomers turning 65 every day. That's going to go on for another 12 years. And by the way, once we hit that age, we take 3 times the number of medications as the younger population. So, we have not reached the pinnacle of costs associated with healthcare or the demand for healthcare. So, the good news is we're in an industry that's going to continue to grow. We're on the forefront of, innovation that can bring meaningful change, and solutions to, what ails, healthcare. And I think that's a good reason to buy our stock.
Okay, and the Affordable Care Act, has it helped your company, hurt your company, had no impact on your company?
You know what, I would say the impact of the Affordable Care, expanding eligibility for the Medicaid population was a benefit, to our companies and, others as well. I do think that there are elements of, the Affordable Care Act that, have been especially, the elements around prevention and coverage for preventive activities that have been a benefit.
Now, the average person who comes into your store, when he or she leaves, they've spent what amount of money? Is it the average person spending $5 a visit, $10, $20?
No, if you leave pharmacy out of this answer, the average person spends about $15 and buys 3.5 items. So
Okay.
it's more of a convenience. We get this question all the time that, well, what about Walmart or Target? And I would sit here and say we share customers, with Walmart and Target. That, they may go to Target and fill up the shopping basket. They come to CVS for that fill-in trip in between.
So you've been the CEO, as I mentioned, since 2014, is that right? Or 2011, I'm sorry, 11. You became the president in 2007, CEO since 2011. How many more years will you want to do this?
You know what? Till it stops being fun.
Okay, that could be another 10, 20 years?
You know what? I don't put a time,
Okay.
on that. There's...
Well, whenever you do step down, if you do step down, would you want to go into government? Do you have any interest in being secretary of HHS or something like that?
That one will not be on the list.
No?
No.
Okay. All right, so for your outside activities, what do you do to stay in shape? Do you have to be healthy? Are you a runner, bike person, golfer? What do you do?
Yeah, I like to golf. I like to bike.
Okay. And what would you like your legacy to be? In other words, when you eventually step down in 25 years from now, whenever that might be, would you like people to say he was the greatest builder of drugstore companies ever, or what would you like them to say?
You know what, David, I think what I'd like to be able to say is that, we were able to transform, the company from its roots as, a pharmacy retailer to becoming, a total healthcare company. And, as part of that transition, always trying to do the right thing for the business and the people in it.
Okay, well, I'm sure you'll have that legacy. I want to thank you very much for your time, and I assume I'm going to get a CBS card soon, right?